So what we're going to do in the next 15 minutes or so is we're going to just review the natural history of mitral valve disease and how the disease process itself can progress to eventually cause signs of heart failure to develop. Now, heart failure as a mechanism, or heart failure as an end result of disease processes, can actually happen secondary to lots of different diseases. But essentially, if we reduce those down, there are probably about 5 different mechanisms that can eventually cause heart failure to occur. First of all, systolic failure can cause heart failure to occur, and that happens when the heart muscle fails to contract normally. And one of the diseases in which we see that quite frequently is a disease called dilated cardiomyopathy, which is probably the second most common disease that we see in dogs. Another mechanism that can cause heart failure to occur is what we call diastolic heart failure, where the heart fails to fill or relax normally. And that disease process, or a common disease process which can cause that to occur, is hypertrophic cardiomyopathy in cats, or equally pericardial effusion in dogs, which are both diseases characterized by the heart being unable to receive the normal amount of blood. But the heart can also fail if it's overloaded in some way, and either if the heart has to chronically pump a greater than normal volume of blood, which we call a volume overload, or alternatively, if the heart is having to work against a greater than normal resistance, which we would call a pressure overload. Either of those processes can eventually exhaust the heart muscle and lead to the development of heart failure. Probably the most common disease that we see in dogs, definitely the most common disease that we see in dogs, is mitral valve regurgitation. And that imposes a volume load on the left ventricle, eventually resulting in the development of left-sided heart failure. Pressure overload can occur when the heart is pumping against increased resistance, and the 2 circumstances where that would occur probably most frequently that we would see would be either with aortic stenosis, or hypertensive disease, which is very common in cats and humans, but less well recognized in dogs. And finally, very rapid rhythm disturbances, so rapid supraventricular or ventricular rhythm disturbances can also cause heart failure to occur. But the disease process that we're going to be focusing on is primary valvular disease, mitral valve disease, and that disease process, as I say, imposes a volume load on the heart. Now, primary valvular disease is brought about by a degenerative change within the heart valve. And histologically, that degenerative change is described as endocardiosis, although it has lots of other terms too. So the disease is also sometimes called degenerative valvular disease. It's called myxomatous mitral valve disease. But essentially what we're referring to here is a single process, which is that the valve leaflets degenerate, and when they do so, the valve begins to leak. So the valve becomes incompetent. And it's such a common change in dogs that probably beyond the age of 10, at-risk breeds of dog, which are typically small breed dogs, beyond the age of 10, as many as 1/3 of them, if not more, would be affected by this disease process. And probably 3/4 of all the cases of heart failure that we see in dogs are secondary to this primary valvular disease. So overwhelmingly, it's the most common disease process seen by primary practitioners. So the pathophysiology of the process starts with the leakage of the valve. So we have distortion of the tips of the valve leaflets. And that distortion means that instead of meeting neatly and preventing blood from flowing back from the ventricle to the atrium during systole, a small leak develops. As that leak develops, what happens is there is regurgitation of blood from ventricle to atrium each time the ventricle contracts. That gives rise to a characteristic murmur that we hear in dogs, which I'll say a little bit more about in a moment. But what happens is, in order to compensate for the leak in the valve, the ventricle must pump a greater volume of blood. And the bigger the leak in the valve, the bigger the additional volume of blood which has to be pumped. So over time, as the disease progresses, which in many animals it does do, the heart will gradually increase in size, the ventricle and the atrium will increase in size, and ultimately, in a very late stage in the disease process, heart failure may develop. It's also thought that heart failure developing in the late stages of the disease process is in part a consequence of the changes which take place within the heart muscle. in that eventually the capacity of the heart to compensate for this additional volume that it has to pump is overwhelmed, and systolic dysfunction develops, which is the failure of the heart muscle to contract normally. So if we look at the diagram which is being illustrated on this slide, what we can see is that if we look at the left ventricle and the left atrium and their relationship to each other, normally when the left ventricle contracts, what it does is it ejects all of the blood ejected from the ventricle into the aorta. So we refer to the volume that's ejected from the heart as the stroke volume. And if there's no leak in the valve, then the total stroke volume, all of the blood that is ejected into the aorta. But as soon as the valve begins to leak, we have an additional volume that's imposed on the heart, which is called the regurgitant stroke volume. And what the heart attempts to do is to compensate such that it ejects a relatively normal volume of blood forward into the aorta. However, it compensates by increasing the volume such that the total volume of blood ejected from the left ventricle is the forward stroke volume going into the aorta plus the regurgitant stroke volume. So the bigger the regurgitant stroke volume, the more the heart has to pump. And as we'll see in a moment, the bigger the heart becomes and eventually the more likely it is to fail.